every event we want to work with you so that we can impact or change our society. Your role is very critical in making sure every mother and every newborn survives. It's the aspiration of every family to have a safe pregnancy and also have their babies safe. So in this Safe Motherhood Conference, we are talking about the theme of multi-sectoral collaboration, how the different sectors can work together to ensure that we deliver safe motherhood where no mother dies because of a pregnancy-related complication and no young baby dies because of the childbirth complications. DG, allow me invite Juliana Lunguzi from UNFPA also make remarks. We are going to keep the remarks brief, 5 minutes, so that we can take a lot of
to make commitments on having live women, newborns and adolescents in Uganda. For us at UNFPA, really, we love this partnership, and it's one that is grounded in a shared goal to ensure that no woman dies giving life, and that every pregnancy is wanted, every birth is safe, and every young person's potential is fulfilled. So we really celebrate this progress that Uganda is making. Really key issues that we are all celebrating, and when you look at family planning, you have rolled up the services with the village health teams and the CHUs. It's something that we commend you, DG and team. While we are celebrating this though, we want to make sure to highlight one of the issues that is really affecting us, and I hope our media will take it, the teenage pregnancy that has really stagnated at 24%. And it kind of defeats the gains that we are making in the area of safe motherhood. So this theme of strengthened multi-sector collaboration and mutual accountability, we feel it's timely because these are some of the things that we can emphasize to make sure that we focus on. And at UNFPA, we have had this great relationship with Ministry of Health, and I know one of the reports that will be shared during the upcoming meeting is on the maternal perinatal death surveillance report. We are happy that as UNFPA, we supported government to make sure that we strengthen emergency obstetric care and supply for commodities which reinforces quality of care through NPDSR. And we also continue as UNFPA to support midwifery-led care. You know, at the center of whatever we are doing in caring for the newborn, the mothers, it's a midwife. It's an agenda that we love at UNFPA and will continue to support, and to make sure that we want to ask you, the media, to continue highlighting the good news that midwives are doing. There are midwives out there who do great job. Sometimes we always highlight the bad news because of one midwife who had a mishap. So we really want to employ that the frontline champions of safe motherhood, they are midwives among the other cadres. Midwives remains to be at the center. Please highlight their story, celebrate them. They need that. And we also want to reiterate access to family planning, which is another life-saving intervention when it comes to averting maternal deaths. We have the youth pre-conference happening right now at Munyonyo, which we have partnered with Ministry of Health to support. To us, we're hoping this platform will share innovations and also influence the safe motherhood agenda here in Uganda. Everything revolves around the 10-year-old. If we can take care of the 10-year-old, so many things can happen that can really skew our results in safe motherhood. We have various projects, the SAY Project I, which are enforcing the programs to make sure that we have safe motherhood in Uganda. And in closing, we want to reaffirm our commitment of advancing safe motherhood through integration, innovation, and inclusivity. We believe that when sectors work together, health, education, finance, gender, and community, we can achieve zero maternal deaths, zero unmet need for family planning, and zero gender-based violence. And let this conference also, including the youth conference, remind us that safe motherhood is not only a health issue, it is a human rights issue and a national development priority issue.
Service delivery at the facilities and communities. So we've tried to reduce on the delays there's a delay for a mother to seek care, there's a delay to reach the hospital, then there is also the delay to be able to access these services. And we have also moved closer to refurbish. We have also gone into construction and equipping of the newborn intensive care units in various facilities where we are supporting. And what is important to note is that while the equipment has been placed there with support from different partners, we are also maintaining, ensuring that it is repaired. If it breaks down, it is maintained, so that we don't have any break in the chain of providing these services to the mothers and the newborns. So it's also important that we have also gone into mentoring and training health workers just to ensure that the quality of services is up to standard. And in addition to that, we have ensured that the logistics is also addressed, supplies are provided, medicines are provided, so we don't have any break in the delivery of these services. So with all the implementation of these practices, we have seen an improvement, and the Ministry of Health, I'm sure, is going to speak to those achievements. We have seen a reduction in maternal deaths, we have seen a reduction in newborn deaths, we have seen an improvement in the
conference. Is indeed a momentous occasion that brings together all partners from different walks of life, including the academia, the different partner, and the health workers themselves will be part of this conference. And we as Save the Children, we are very proud to have walked this journey with the Ministry of Health, not only this time but even previously through the different platforms. We commend the Ministry of Health for always working with us together and sharing goals and visions that we've had as Save the Children. And we do share a lot of strategic plans with the Ministry of Health to align the implementation and to allow us to work together to dent the maternal and newborn death figures that you're seeing. The reduction that we've seen has not come out of one person's effort, but the concerted effort of all the partners working together with the Ministry of Health. Save the Children, working in different contexts, both in the humanitarian and development context, have been able to advance a number of implementation strategies to ensure that mothers and newborn survive where they are. And this is in the spirit of having every woman and every newborn everywhere safe and living when they access services.
Our theme for the Safe Motherhood Conference this year is strengthening multi-sectoral collaboration, mutual accountability for safe motherhood. So once again, a good morning, and I want to recognize the presence of the chair of the development partners, all the other partners, the media, my colleagues from the ministry, and all the fellow advocates of the maternal and newborn. And I think by the time I end this conference, this brief, I would like to inaugurate all of you to be ambassadors of safe motherhood. It's my pleasure to address you today as we prepare to convene the 5th National Safe Motherhood Conference under the theme of strengthening multi-sectoral collaboration and mutual accountability for safe motherhood. So this year's conference comes at a very pivotal moment in our national health journey, and Uganda has made very remarkable progress in reducing maternal and newborn mortality. However, we recognize that every preventable death remains too many. So safe motherhood is not just a responsibility of the health sector alone, it's a shared national priority that calls for a collective action from all the sectors of government, development partners, civil society organizations, the academia, the private sector, the media, and the communities themselves who are the beneficiaries of these services. I must report that our antenatal coverage reflects the strides which we have made. The first antenatal attendance stands at 97%.